For most of us, the college years are a critical part of our adolescent development, giving us the skills to succeed as adults and in our careers. But for far too many college students, partying and binge drinking has become the norm. For example, did you know that according to the National Institute on Alcohol Abuse and Alcoholism, about 4 in 5 of all college students drink alcohol, and 40% report binge drinking, meaning they have consumed 5 or more drinks in 2 hours.
In many college social situations, drinking is seen as an essential component of socializing, part of the fun and social success on campus. The college environment is really important in whether students drink. Schools where there is a large, active Greek system, schools with prominent intercollegiate athletics, and schools with a high density of bars in the surrounding communities typically have higher rates of college student drinking and binge drinking. In addition, the college schedule makes a difference. The first 6 weeks of freshman year have been identified as a time of a special vulnerability to binge drinking. Many students coming to campus with already in place heavy drinking patterns, but many students will be drinking heavily for the first time. A recent study showed that in schools where there are no Friday classes, the weekend starts on Thursday, and so does the partying. And school vacations are also a time of increased risk for binge drinking. They take their heavy drinking habits with them.
And while some parents may view college drinking as a harmless rite of passage, the damaging effects that drinking, especially binge drinking, can have on the mind, body, and a student's life are anything but harmless. Research shows that 1,825 college students between the ages of 18 and 24 die each year from alcohol-related unintentional injuries, including motor vehicle crashes. 599,000 students are unintentionally injured under the influence of alcohol. More than 97,000 students are victims of alcohol-related sexual assault or date rape. About 25% of college students report academic consequences of their drinking, including missing class, falling behind, doing poorly on exams or papers, and receiving lower grades overall. College students who first became intoxicated prior to age 19 are significantly more likely to be alcohol dependent and frequent heavy drinkers. And binge drinking also impacts a young person's brain, since our brains continue to develop into our 20s. Binge-like drinking affects memory, alters sensitivity to motor impairment, and damages certain brain regions. Prolonged alcohol exposure produces long-lasting neurophysiological impairments in cortex and hippocampus.
You may wonder if college students are getting the help they need for their drinking problems. According to a recent survey conducted by the National Institute on Alcohol Abuse and Alcoholism, 19% of college students aged 18 to 24 meet criteria for alcohol abuse or alcohol dependence. Only 5% of them reported seeking help for their alcohol problems. Another 3% reported that they considered getting help but didn't do it.
So, what's the solution? Collaborations between colleges and their surrounding communities can help reduce alcohol problems among college-age youth. Research by the NIAAA confirms this. So does years of experience by communities across our nation.
There's been a lot of research that's looked at comprehensive, what we call comprehensive community interventions to reduce alcohol problems and other types of health problems. And basically what those involve is trying to coordinate the efforts of multiple departments of city government, the health department, the police department, the school department, alcohol beverage control, concerned private citizens, people such as CADCA coalitions. What they try to do is intervene at multiple levels. School-based intervention, family-based intervention, interventions around policy to reduce availability of alcohol, enforcement of legal drinking age, drinking and driving laws, media advocacy, and multiple types of interventions applied simultaneously. There's been some recent evidence emerging that this type of campus community partnership can be effective in reducing drinking and alcohol problems, even among college students who have been the most difficult group to make inroads with. One called the Matter of Degree program implemented beer keg registration, alcohol-free dorms. There were bans on alcohol advertising. Campus and community police engaged in surveillance of parties to make sure that they didn't get out of hand. And what they found in that program was that they achieved reductions in binge drinking among college students, in driving under the influence of alcohol, and alcohol-related assaults. There's no single silver bullet that's going to work, but collective action at a variety of different levels can make a difference, and community coalitions are uniquely positioned to try to coordinate these different levels of intervention.
There are important roles for all of us, whether you're a parent, alumni, student, coalition leader, or just a concerned citizen. By being proactive, coalitions are building meaningful town and gown partnerships with their local colleges and universities. And they're putting in place policies and environmental strategies to keep students safe and healthy. Strategic partnerships aren't always easy, but they're showing results in both the perception of college drinking and the actual behavior of students. For more information, visit CADCA.org and collegedrinkingprevention.gov.